Me from Final Year BDS. I'm presenting a topic on myself, Priyadashni from Final Year BDS. I'm presenting a topic on bleaching of discolored tooth. We know that aesthetics is an important factor in a patient's decision to undergo any endodontic treatment. The normal color of the primary teeth is bluish white. For permanent teeth, it is grayish yellow, grayish white, or yellowish white. For elderly persons, it is more yellowish than the younger persons. Let's see how the tooth discoloration takes place. Usually, the tooth discolorations are basically classified into extrinsic and intrinsic discoloration. In extrinsic discoloration, the chromogen or the stains which is present on the outer surface of the tooth, the causes are tobacco stains, greenish discoloration associated with nasal membrane in children, silver nitrate stains, put stains, etc. And intrinsic discoloration. In intrinsic discoloration, presence of chromogen in the enamel as well as in the dentin. Causes are amylogenesis imperfecta, dentinogenesis imperfecta, decomposition of pulp, trauma, filling materials such as amalgam restoration, endodontic materials such as intermediate restorative materials, aging, iatrogenic discolorations, and endemic fluorosis. In this picture, we can able to see extrinsic stain caused due to tobacco, and in this picture, we can able to see intrinsic stains due to amylogenesis imperfecta and dentinogenesis imperfecta. These two cases are during odontogenesis process, and in endemic fluorosis, we can able to this type of yellowish discoloration, and in tetracycline stains, we can able to see the lines in the cervical third of the crown. Pink tooth is usually caused due to trauma, and yellowish discoloration is due to aging process. Let's see what is bleaching. Bleaching is the process of lightening of the color of the tooth through the application of chemical agent to oxidize the organic pigmentation, that is the stain which is present in the tooth. The mechanism of bleaching are: here, the tooth acts as a reducing agent, so it takes up the electrons from the bleaching agent, which acts as an oxidizing agent, which gives free electrons to the tooth. And here, the free reactive radicals, which is present in the bleaching agent, react with the unsaturated bond in the stains and convert these larger stain molecules into a smaller one and into a simpler molecules, so it reflects very less light or it becomes colorless. Usually, the commonly used bleaching agents are hydrogen peroxide 5 to 35%, carbamide peroxide 3 to 45%. Most popular concentration is 10% carbamide peroxide, sodium perborate. Over-the-counter agents are chewing gums, toothpaste, bleaching strips, etc. And the classification of conventional bleaching procedure are intracoronal and extracoronal bleaching. Intracoronal bleaching is nothing but bleaching takes place in the non-vital tooth or bleaching of endodontically treated tooth. And extracoronal bleaching takes place in the vital tooth, so it is called as vital tooth bleaching. In intracoronal bleaching, we have two techniques. One is walking bleach technique and another one is in-office thermocatalytic bleach. In extracoronal bleaching, we also have two techniques. One is in-office vital bleach and another one is at-home vital bleach. Let's see bleaching of vital teeth in office. In this technique, we use 35% carbamide peroxide. Here, the bleaching takes place in the dental office by the dental professional. Here, the 35% carbamide peroxide is usually used, commercially available in the form of gel that prevents running of the material on application. Here, the catalyst which is present in the bleaching agent, it gets activated by the heat or light, and so it is called as thermocatalytic bleaching. With this technique, patient complaints is not a major factor because we can able to attain the results in 2 to 3 visits. So the indications for vital teeth bleaching at office are discolored tooth, severe discolorations before undergoing the bonded resin restorations of porcelain veneers, and in order to match the existing color of the crown, that is lighter than the natural teeth, The contraindications are superficial stains which can easily removed by rubber cup and prophylaxis paste, carious tooth structure, hypersensitive teeth, children with large pulp chamber, pregnant and lactating women, exposed root surfaces. So the procedure which we usually do in vital teeth bleaching at the dental office are: first we have to take the radiograph of the tooth to be bleached. In this radiograph, we have to assess the presence of caries, defective restorations, and proximity to the pulp horns. Then we have to evaluate the tooth color with a shade guide, and we have to take the clinical photograph of the patient before as well as throughout the procedure. We have to protect the gingival tissues with Ora base or Vaseline, and we have to isolate the teeth with a rubber dam before doing the bleaching procedure. Then we have to clean the enamel surface with the pumice and water. Then we have to apply 30 to 35% of hydrogen peroxide liquid on the labial surface of the tooth. Bleaching gel is usually preferred for the confined placement of the gel in the particular tooth to be bleached. So the application of heat is generally used to activate the catalyst and the bleaching agent. The treatment should not exceed 30 minutes even if the result is not satisfactory. Pumice is used on the teeth to remove the residual exposed gel. Then we have to remove the bleaching agent, and we have to irrigate the tooth thoroughly. Then we have to dry the teeth, and we have to apply a neutral sodium fluoride gel for 3 to 5 minutes to close the dentinal tubules to prevent dentinal hypersensitivity after bleaching. And we have to instruct the patient to use fluoride rinse daily for 2 weeks, and we have to advise the patient to avoid any bonded restorations for almost 7 to 10 days after bleaching procedure takes place. In this picture, we can able to see the various steps which is taking place in the bleaching of vital teeth in office. Next, we will see bleaching of vital teeth at home. At home, vital bleaching is more commonly used technique because it is easy to perform and usually it is less expensive for the patient. In this procedure, we use custom fit tray with 10% carbamide peroxide. Carbamide peroxide is usually more stable than the hydrogen peroxide. Let's see about indications of vital tooth bleaching at home. Superficial enamel discolorations, mild yellow discolorations, in brown fluorosis discolorations, and in age-related discolorations. We will see contraindications of vital teeth bleaching at home: severe enamel loss, hypersensitive teeth, bruxism, presence of caries, defective coronal restorations, allergic to bleaching gels. Let's see about tray fabrication procedure, the vital teeth bleaching at home procedure. Here, this involves the fabrication of vacuum pressed tray over the dental cast. First, we have to, in the first visit of the patient, we have to take alginate impression of upper and lower arch, and we have to pour a cast, and we have to trim the base of the cast almost 0.5 inch thickness. We have to leave only the maxillary and mandibular teeth, and we have to trim off the vestibular region, palatal surface, tongue for better adaptation of the tray material. Reservoirs such as light polymerized resin of 0.5 to 1 mm can be placed to increase the space for the tray for the placement of the bleaching gel. The material used in the fabrication of tray is thick semi-rigid plastic material. Extent of the bleaching tray is determined by the viscosity of the bleaching agent. The instructions to the patient are preoperative photographs are very important because bleaching action occurs gradually over time, so the patient might forget the original shade of the teeth. So the fit of in the second visit of the patient, the fit of the bleaching tray should be checked to avoid irritating margins. The patient should be instructed to brush his or her teeth prior to the application of tray. and any surface debris minimizes the effective contact of the bleaching agent with the tooth surface. The patient should be instructed to place enough bleaching agent into the tray to cover the facial surfaces of the teeth. After seating of the tray, excess bleaching material extruding on the gingival surface should be carefully wiped off. The tray should be worn for a time period of 4 hours for every session. While removing the tray should be peeled off from the second molar region to avoid injury to the soft tissues. So after every bleaching session, the patient should be instructed to rinse off the bleaching agent from the surfaces of the teeth. So the number of days or the time period required to achieve desired results may vary from 2 to 14 days or as long as 6 to 12 months. In case of uneven distribution of discoloration of teeth, the tray can be loaded in areas corresponding to the teeth that require further bleaching. The patient should be instructed to maintain periodic visits to the dental clinic for assessment of the bleaching process. Thank you.